This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. Free monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. For an application, call 944-8344. That's 944-8344. Or visit our website at www.vsh.org. vsh.org.
It's now time for tonight's special guest, who has arrived. Yay! We almost had a historic event. We've had these meetings and speakers every single month since June of 1990, and we have never missed one. But we almost had a special event tonight, so didn't. Dr. Kristofich is board certified in cardiology and internal medicine and leads the Heart Check program at Straub Medical Center. His special interests include preventive cardiology and early detection of cardiovascular disease. He received his medical degree from the University of Medicine and Dentistry of New Jersey, Robert Wood Johnson Medical School. He completed his residency at Lehigh Valley Hospital in Allentown, Pennsylvania, and his fellowship at Geisinger Medical Center in Danville, Pennsylvania. Please welcome Dr. Kristofich.
Good evening. A pleasure to be with you here all. Traffic's pretty heavy on Ala Moana. I'm going to talk about cardiovascular disease tonight. Cardiovascular disease is the leading cause of death in the United States, both for men and for women. It'll take our lives about 45% of people in the country, so it's a big cause of death. It's often heralded unexpectedly by a heart attack or stroke with tragic consequences. And I put unexpectedly because it's not really unexpectedly if you see the writing on the wall that occurred for 10, 15, 20 years beforehand based on how we conduct ourselves day to day, what we eat, and whether or not we get enough exercise in our diets and such forth. So unexpectedly should be sort of in quotations. Atherosclerosis is the term. It's the process by which the arteries of the body become blocked. The blockages or plaques that your doctor may tell you about or be worried about. This is not a natural process. So it's not like aging where the hair turns white, we get kind of shorter over the years, our spinal column loses 3 or 4 inches. This is not a natural process. Ironically, the thing about cardiovascular disease is that the risk factors are very well known and the disease is highly preventable. So why are we all dying from it in our society? So tragically, there is a huge personal, social, societal, and economic burden associated with cardiovascular disease. Now, if you look at the estimated direct costs of cardiovascular disease and stroke in 2004 in billions of dollars, you can see here that it roughly accounts for about $226 billion estimated direct cost of cardiovascular disease. And then you have the subfractions looking at congestive heart failure, right here, stroke, hypertension, and etc. CHD is coronary heart disease. Basically, atherosclerosis affects all the arteries in the body. So, every bit of our tissue is supplied by arteries. The brain arteries, if they get a problem, they can cause a stroke. The heart's arteries, if they cause a problem, they can cause a heart attack. The leg arteries can have a claudication or problems walking, pain in the legs, or need for surgeries down in the legs. So it's a big problem. And if you look at our total health expenditures per capita, so for each one of us individual people here in our audience tonight, in 2002, there was about $5,400 were spent for each of us towards total health expenditures. Now, you may not have consumed that, but if you take the whole glutton of how much we paid to take care of our health in 2002, let's say, you can see that it's about over $5,000. In 1990, it was about just a little under half. And the major modifiable risk factors, these are the things that we should be cognizant of, include diet, leading to an elevated total cholesterol or total LDL cholesterol, what is called the bad cholesterol. Smoking, clearly a major modifiable risk factor. Diabetes, elevated sugar in the bloodstream. The thing about diabetes is a lot of us can have diabetes and not know about it until 10, 15 years. Many times diabetes starts out very early before we even have any symptoms. Okay? Obesity is a big problem in the country today. Obesity since 1970 has nearly doubled. And that's a continuing problem, especially in our youth. Hypertension or high blood pressure, we do a poor job. Nearly 1 in 3 Americans will have high blood pressure in the next 10 to 15 years, and only a quarter of them will be actually well controlled. So that's a big problem. Inactivity, clearly we're getting lazier. I think maybe it's a societal issue where we don't have enough sidewalks to walk on, we don't have enough activities, we're very sedentary, our jobs, our leisure activities, computers and like, we're very inactive. And psychosocial stress, which is not really thought of much, but I'll discuss that in somewhat a little bit in depth about different types of personality traits, isolation, anger, that sort of thing, and stress and how that relates to cardiovascular disease. But these are clearly the major modifiable risk factors. The prevalence of coronary risk factors in the United States, basically, if you look here, LDL cholesterol, which is the bad cholesterol, greater than 130 is about 46%. Greater than 160, about 16%. So enough cholesterol to cause coronary disease. Basically, the human being only requires about 40 or 50 milligrams per deciliter of cholesterol to exist. Clearly, if you have an LDL of 120, 130, you have 3 or 4 times the amount that we actually need. HDL, that's the good cholesterol. If that's low, it's a risk factor. So how many of us have higher than 35? That's only about 46% in men, and about 19% in women. And then likewise, the other risk factors including cigarette smoking, diabetes, being overweight, 54%, obese, 22%, and activity, 28%. Now, we didn't talk much about age, sex, and family history. Well, we can't do much about our age. I mean, what's the alternative besides not aging? Sex, you can't do anything about your sex that you're born with unless you go see a good plastic surgeon. And family history, you can't choose your parents, although some people would want to choose them. So, well, let's look at age for both men and women, starting from 20 to 24, all the way up to age 75, and the percent of the population. Now, this is the prevalence of cardiovascular disease in Americans 20 years of age or older in 2003. And you'll notice certain things. Well, clearly, as we get older, the prevalence increases. I mean, that's pretty obvious. But look at what happens with men and women. At around age 65, you can see that the prevalence rates are about the same. Women tend to be a little bit more protected in their younger years. So if you look at the younger men, younger women, 20s and 30s and 40s and even the 50s, clearly the yellow is more than the pink. So there are more men in those age groups having prevalence of cardiovascular disease. But then after age 65, that difference changes. And actually, in the older population, actually women take the lead in that department of having more cardiovascular disease. Now, realize that the combination of risk factors have multiplicative effects. Sometimes my patients come to me and they say, well, I had this LDL of 160, this bad cholesterol, but am I going to have a heart attack? Well, if they have no other risk factors, it's kind of unlikely. It's very unlikely. These things work in conjunction with other risk factors. So you have to sort of look at all these things together. And what we have here, just to kind of explain this a little bit further, is a little diagram showing what's called the fatty streak and the fatty plaque. The fatty streak is above and the fatty plaque is below. It's a little bump in the road. So if you're driving down the road and you go over a little speed bump, it's basically a little bump in the road. The fatty streak is a small bump, and the fibrous plaque is a bigger bump. And this basically has a lot of gruel in there, a lot of cholesterol, a lot of fibrous fatty tissue. And this is sort of like the carpet of this vessel is kind of lifted with some garbage underneath the carpet. The fatty streak is the early form of atherosclerosis. It forms even when we're in our teens. So we all have it. In this audience right here, it's quite a bit of people, we all have fatty streaks, clearly. And half of us are going to die from cardiovascular disease. The more advanced form of the disease is called the fibrous plaque. It's more fat inside there. It's a lot more gruel inside this portion over here. And these things can unexpectedly rupture or erode to cause a heart attack. So if we look at what's the effect of multiple risk factors, these are young patients. These patients all died from something other than cardiovascular disease. But what they looked at the fatty streaks and they looked at the fibrous plaques. And they looked at both the aorta, which is the big blood vessel coming out of the body, and they looked at the coronary arteries, which are the arteries that supply the heart. And if you look at the risk factor number, either no risk factors, 1, 2, or 3 to 4, you notice something. You notice that the more the young individual had these risk factors, they were a smoker, high blood pressure, smoking, stress, whatever, you notice that they have definitely more involvement of these fatty streaks and fatty plaques, again showing that these risk factors work in conjunction with one another. Here is another thing. This is how two risk factors can kind of work against each other. Here is the HDL, which is a good cholesterol. The LDL is a bad cholesterol. And we have on the bottom here the LDL readings, which is the bad cholesterol, 100, 160, and then 220. Over here in the little pictures, we have the HDL cholesterol, which is the good cholesterol. So you want a very good high HDL. You want it to be high. So you want it to be 85, let's say. So we see that for an individual who has a high LDL and a very low HDL, 25, you can see that their coronary disease risk, or heart disease risk, artery risk, is threefold that of the general population. Whereas if that individual has a very good HDL, very high HDL, their risk is a little bit elevated. Well, actually, it's not even elevated at all. It's about half, about 0.5%. You can see that a HDL level is protective for the person, whereas the LDL is more damaging. Okay, and you can see basically having an LDL of 100, which is quite low, and in some circles not low enough, but if that person has a very poor HDL level, you can see that the risk is 1.5-fold higher at that range. So when I look at patients, and a lot of patients come in, their LDLs aren't that high, but they may have a low HDL, and those two things will work with each other. So what's the relation between cholesterol now and saturated fat intake to blood lipids? Well, clearly, there's a clear and definite causal relationship between the amount of saturated fat and cholesterol in the diet and the blood cholesterol level. Clear, unequivocal from multiple studies, epidemiologic, observational studies. This has been shown, most famously of which was the Mr. Fit trial, 350,000 men, and of course the Framingham database, which is a very large database dating about 50 years ago. There's clear and definite evidence that reducing the serum blood lipids by diet or medication reduces the incidence of cardiovascular disease. And let's look at this a little more closely. Blood cholesterol and diet, saturated fat and cholesterol. So if you look at the percent of saturated fat in the diet and we look at the blood cholesterol level, we see certain things. One, 40% fat intake, which is probably the normal American diet. The average cholesterol is about 208 milligrams per deciliter. Is that enough to cause cardiovascular disease? Yes, it is. Having a cholesterol about 200 is very high enough to cause cardiovascular disease. Maybe Dr. Harris remembers years ago, an average cholesterol of 240, 250 was considered normal at one point. It was not a big deal to have that type of cholesterol. That's enough cholesterol to cause cardiovascular disease. As we lower the fat intake to about 10% saturated fat, the blood cholesterol level doesn't really change much. If it started over here, it only drops a little bit, may drop about 10 or 15%. But when you get the cholesterol below 10% saturated fat intake, that's when it really drops, such that if you can reduce your total fat intake to less than 10%, which is achievable with vegetarian and definitely with a vegan type diet, you're going to find out that your average cholesterol is going to drop to 150. And it's literally unheard of in a vegetarian or a vegan to have cardiovascular disease, simply because that type of diet is so devoid of saturated fat and cholesterol that the total cholesterol will be very low and the incidence of cardiovascular disease is very low. And nobody would dispute that today. Nobody would say that, oh, that's not true. It's well known, and that's the case. So if thinking about the diet, that's why 45% of us are dying from cardiovascular disease, because if we're not really on the ball with these things in terms of our diet, we're going to suffer with this cholesterol level and cardiovascular disease. This is a very interesting study. It came out from the Lancet last year called the INTERHEART trial. This is a great study. It looked at worldwide, 52 countries. They looked at 12,461 cases of first-time heart attacks. So patients who came into the hospital across the world, and they looked at risk factors, many of the risk factors we talked about. And they found out, the results showed that 90% of the patients with the first-time heart attack could be predicted on the basis of certain risk factors and lifestyle choices. And this is looking at the cholesterol data. Okay, they call it the ApoB, ApoA1 ratio. Basically, that's the ratio of the bad cholesterol to the good cholesterol. So if you take the bad cholesterol and then you divide that number by the good one, you get a number. how does that fare to, did they have a heart attack? And they compared it to case controls, which were kind of matched for age and sex and such forth. And what they found out is that the higher the ratio, the more bad cholesterol to good cholesterol ratio, the higher was the risk, such that at the highest tercile, 10, the ratio is 8 times the risk of having a heart attack. Clearly, unequivocal evidence that higher the ratio of bad cholesterol to good cholesterol, the higher the incidence of having a first-time heart attack. Now, to kind of go over the coronary circulation, it's very elegant. There are 2 major arteries that supply the heart. That's the left main artery, and all these branches come out, and the right coronary artery. If you think about heart attacks in general, the heart is an innocent bystander. The heart is minding its own business, and all of a sudden somebody cuts off its air supply, and so the heart muscle will die as a consequence. That's what a heart attack is. When we look at the artery itself, it has 3 layers. It has an intima, which is a 1-cell layer thick layer, the media, which is the muscle layer, and then a skin layer, or the adventitia. And a lot of the action, a lot of the activity goes right here on the intima. And I'll just kind of briefly show what happens in some detail. This is a good time to take a nap if you're not interested in biophysiology here right now. I'll wake you up. What happens? Well, let's start over here. The LDL is the cholesterol. Cholesterol freely goes into the artery wall. It goes right through that intima layer that actually is in contact with the blood, which is right here. So this is a slice through the artery. The cholesterol goes through, the LDL, and it can go right back out. But what can happen to the cholesterol is that it can be modified. It can be modified. So if you're a smoker, let's say, if you have diabetes, a lot of stress, poor diet, let's say, what happens is the cholesterol gets modified. It changes its structure such that it can't leave anymore. It has to stay there now. That's what they call modification of the cholesterol. And that's what these little darker looking balls here, this one and this one, that's a modified, or they call oxidized LDL. Well, what happens then? Well, they're intruders. They're not really wanted in that area of the cell. And what happens is some of the cellular elements in here will then recognize that cholesterol as being injurious, and it releases chemicals. And these chemicals will then tell these lining cells to call in the troops, call in T cells and macrophages. These are cells that actually contribute to plaque formation. And so you'll see here, here's an intimal cell. It's got these adhesion molecules, and here comes a monocyte. It gets attached, and then it kind of squeezes its way through right there, right inside, and starts to go inside the cell wall. And these are very injurious cells. They then turn into what's called macrophages, which are here. And what those macrophages, like Pac-Man, they start eating up the cholesterol. They start kind of gobbling it up. And what happens if they have a lot of it? They gobble so much of it that they get so full and so distended that they're going to rupture and die. And when they do that, when they rupture and die, they become what's called foam cells. And these foam cells, they're foam cells because they're chock full of cholesterol. They start to release all this cholesterol right in here, and it really causes a disaster. They start leaking out all this oxidized LDL that they've been accumulating for weeks and months, and that then starts to lead to production of other chemicals that then invite these guys, the smooth muscle cells, into the skin layer, and they then form the plaque. And so what you have here is a bunching up of all these cells forming that bump in the road that I was talking about earlier, that fibrous streak and the fibrous plaque. So let's take a look at a heart attack in the making. Here's our artery. Here's a lipid pool. Okay, there's a bunch of cholesterol and fibrous fatty tissue. There's the skin layer over it. Okay, it's like a bump in the road. And what can happen is that all of a sudden, it can rupture or it can erode. So the surface of that plaque can rupture or erode. Now this can happen. A person could be having a nice day, Sunday, 18 holes of golf, no problem. Monday morning, argument on the phone, hangs up on very angry, hostile, blood pressure shoots up, and then what happens? You rupture this plaque here, you erode this plaque, and now the blood, which is kind of streaming past this thing, can actually enter in to this safe lipid pool here, and when that happens, it just makes a blood clot. And that's what you see here. You have the formation of what's called an intraluminal thrombus, And then if that propagates and gets even more, it can actually totally occlude the artery. And that's when all of a sudden the chest pain comes, the person gets out of breath, and a heart attack occurs. And so unexpectedly, yeah, it can occur unexpectedly. But if you look back in the chain of events, it takes years for this process to occur to form these plaques. And here's some real pictures of this. Here's as you'll see, here's an artery. Okay, here's the artery right around. Here's the lipid core, that bump in the road. Here was once the cap, the fibrous cap, going right over it. And this all inside is the lumen. This is where the blood was coursing through. So you see, you can look at this whole slice of the artery and say, well, you know, there's a lot of room in there, you know, for the blood to go. Yeah, there's a lot of plaque all around. But this person probably didn't have any symptoms until they ruptured this fibrous cap, and the blood was exposed to this cholesterol debris inside, and then caused this thrombus, this clot to form and occlude and take the person's life. This is another picture, two arteries, same thing. This is where the blood is flowing in the blue, as depicted by this letter C. Here we have a lot of calcium, a lot of sclerosis or hardening. That's where you get the term atherosclerosis. It looks hard and all calcified. These clefts in here are remnants of the cholesterol, because when they stain this, the cholesterol is a fat and it kind of leaks out. So all you see is the clefts. These are all cholesterol clefts in here, what they call a lipid-rich core. And again, this lumen was very narrow, so the blood was very restricted in this area, but here's the clot as well, this T for thrombus, and it looks red. Similarly, look at this one. This is all collagenous fibrous tissue, small lipid pool, and here's where the blood is coursing through the artery. Here's another one. Again, the artery confines, a big lipid plaque, big plaque. Here's the cap, eaten through over here. Some of those Pac-Mans, they actually make enzymes that digest that. And then again, here is the telltale sign, the red thrombus occluding the artery. Here's a completely occluded thrombus inside. There's our cap. Here's the lipid-rich core. Again, there was a rupture, an erosion, probably an erosion in this area, and that stimulated the blood to clot. And similar, another picture, again, a big lipid-rich core, thrombus, and again, inside the artery. So again, this is just all faces of the same thing, atherosclerosis. Okay. Here's another picture. This is the left main artery. This is a big clot inside. Here's actually where the plaque ruptured. And then what happened is, since no blood was going through, it kind of all backed up and clots off all the way up the artery. This person also died. And here's a bypass graft. You know, we like to think that when we bypass the arteries, we actually cure the problem. You don't cure the problem. You just get to fight another day. And this patient found this out 2 years later when the graft to one of the arteries, bypass graft, actually just occluded, again, from a ruptured plaque. And this graft is actually patent, but it doesn't matter because this patient died. So let's look at some common myths and truths. Well, how could I possibly be having a heart attack? I played 18 holes of golf just the other day. Well, clearly, because yesterday when you're playing the 18 holes of golf, there was no problem with the blood flow going down that artery. It was a little bit restricted, but you really didn't have any symptoms. And then the next day, when it eroded and ruptured, whammo, it clotted off quickly, and within 15, 20 minutes, you know, it's a heart attack. The doctor told me I only had one blockage that was stented. The other arteries were clean. Again, when we go in and we do an angioplasty, put a stent in there, and we fix one little area of the coronary circulation, that doesn't mean people can't have to worry about the rest of it. Clearly, there is more plaque throughout that whole arterial network. So if a person has one blockage, roughly 40% of the surface area of the artery volume inside the artery is blocked. If it's two major blockages, it's roughly 50%. Three major blockages, roughly 60%. And then four major blockages, so somebody needs bypass, let's say, roughly 70% of the volume of their artery that should be open is occupied by plaque. 70%. So when one person comes in and gets an RCA angioplasty, one artery, roughly 40% of their pipes are clogged with rust. Okay, I had a catheterization the other day. I only had some minor blockage. I did not need an angioplasty or surgery, so I should not have to worry. This always gets me. We see patients in the cath lab. We do the arteriogram, And every artery is open, there's good blood flow down the artery, but there must be some lumps and bumps in there. Those are the lumps and bumps that cause heart attacks. My stress test was normal. That means I am perfectly all right and won't have a heart attack. Again, a fallacy. The stress test can only pick up fairly advanced disease. It may actually miss single vessel disease. And once I had my bypass operation, I'll be fine and don't have to worry anymore about having another heart attack. Again, you're only bypassing the problem. You're not actually treating the problem. You're treating the symptom. And roughly about 50% of all grafts are occluded by 10 years. Well, we tend to think, Dean Ornish wrote this, we tend to think of advances in medicine as a new drug, a new surgical technique, a laser, something high-tech and expensive. We often have a hard time believing that the simple choices we make each day, what we eat and how we respond to stress, whether or not we smoke, how much we exercise, and our social relationships support us, can make powerful differences in our health and well-being, even our survival, but often they do. And that is really the truth. And again, Dean Ornish, you'll see him right here. He has a program out in Sausalito, California. He's got a preventative health care workshop there. And then I'm sure people who recognizes that book, Dr. Atkins, his New Diet Revolution, the must-have new edition. He died in 2003, grossly overweight. To me, it's really unbelievable how a cardiologist could push this diet and how so many people, the best-selling book, can sell so many copies. It's just really amazing. A lot of people don't hear about Dean Ornish, though, but he has a really good program to reverse or actually prevent coronary disease. Well, let's look at the reversal diet, the Ornish Program. Basically, it's very low fat, has almost no cholesterol, has less than 10% calories from fat, and little of it is saturated. High in fiber, allows but does not encourage moderate alcohol, excludes all oils and all animal products except non-fat milk and yogurt. It does allow egg whites, excludes caffeine, other stimulants, and MSG, and allows moderate use of salt and sugar, and it's not restricted in calories. So it's called a reversal diet. Talking about fat, we have three different types. Saturated fat, polyunsaturated, monounsaturated. Saturated fat is the bad fat. That's the one that you find in things such as chicken fat, 31%, or beef fat, 52%. That's the same stuff that gets in the arteries. The monounsaturated, in the green, is the good oils. That's what you see, let's say, in canola or olive oil. Basically, canola oil has the least saturated fat, 6%. Even olive oil has about 14% of saturated fat, believe it or not. So a good oil, a very good oil, is canola oil, soybean oil, and you can see the difference the animal fat can make. The Ornish Program is a very low-fat, again, whole foods, vegetarian, near vegan diet, half an hour per day of walking or other exercise, half an hour a day of stretching, meditation, relaxation, and stress reduction, psychological and emotional support groups, very heavy on the psychological aspects of disease, which I think he's right on. No smoking, absolutely, and has been shown to improve symptoms and improve myocardial blood flow in coronary heart disease patients, unlike, let's say, the Atkins program. This is an article that K. Lance Gold, Dean Ornish published back in JAMA, and they looked at patients with known coronary disease on the Ornish Program versus the usual care by physicians. What they looked at was the size and severity of the blood flow defects on a special scan called a PET scan, and they showed how that looked before and after they treated some patients with this very good Ornish-type program, reversal-type program, or usual therapy type program. Doctor would just say, well, try to get, stop smoking, get exercise, that sort of thing, try to watch your diet. This is very intensive lifestyle modification. PET scan, you're going to see 4 pictures. PET scan is a scan that looks at positron emission. It looks at absolute blood flow. You can actually look at absolute blood flow to the heart. And the heart is shaped like a bullet with the base here and the apex there. And you can more or less make it into 4 walls, almost like a room. So you're going to see a septal wall, an anterior, lateral, and an inferior wall. So let's look at that. The usual care. Well, if you look at the usual care on the top, the areas in white are very good blood flow. Okay, these areas, very good blood flow up in here. The orange and reddish areas, moderate blood flow. The green areas, much less. The purple, very much less. And the black, almost gone. So you can see that this is a patient with coronary disease. Maybe he had a heart attack here, and he's got some reduction in blood flow. After 5 years later, look what happens. The PET scan picks up all these darkened areas. Compared to this one, here it's much pinker and red and orangey, but here the blood flow has really been depleted. This is usual care. This is pushing an aspirin, giving a beta blocker, nitrates, not really taking the bull by the horns, so to speak, and saying, what can I do to really improve this? You can see that this is the advancement of coronary disease. This is progression, worsening of atherothrombosis, atherosclerosis. But look at what intensive lifestyle management can do with the baseline showing very depleted areas of blood flow in this patient. After 5 years, you can see that these areas start to actually fill in. Look here, all this purplish and black area starts to actually fill in. This is improvement in blood flow. Similarly here, you can see all this darkened area, very black, and almost completely filled in. The white areas are getting more white. That means even more intense blood flow. The very bad areas are getting some blood flow. I mean, there's still some scarring there, but again, an improvement, not a worsening. So definite intensive lifestyle management can do it, but it takes a lot to go after it. So why is Atkins so popular? Well, it's been widely translated into some 24 different languages except Italian. You're never going to make the Italians give up their pasta. It's an impossibility. Forget about it. They say scordatella in Italian. It plays also into what people are currently consuming and justifies it. They say, hey, I can lose weight without giving up all those foods I enjoy so much. So, they feel they can have all the bacon and eggs and everything else, and that they're going to lose weight. Weight loss with Atkins, and this has been shown, is predicated on calorie restriction, as just about every other diet. I can make anybody lose weight. I can put you on a peanut butter diet. You're going to lose weight. Why? You can have peanut butter for breakfast. All right. Then you have for lunch. You have for dinner. Next day, peanut butter. Okay. All right, lunch, same thing. Dinner, next day, next week. You're going to get so sick of peanut butter that you're going to start restricting how much you take in. You're going to take a little bit in, you're going to get so sick of it, you're going to lose weight. And it's true. Any type of diet loses weight by just restricting what you eat. Okay? So if you do this diet, that diet, I'm going to go on a string beans and 1 calorie pop, you're going to lose weight. That's what's going to happen. So it's all about calorie restriction. The idea on restricting simple sugars seems correct, and I would agree with that, and I'll show you more about that. The problem is, and this is what Ornish said, is that one can also lose weight by taking chemotherapy or exposing yourself to dinitrotoluene, the precursor of TNT, but I wouldn't advise it. Okay, so you can lose weight with chemo, and similarly DDT, the insecticide, can raise the HDL level, but I don't see any of us going out to DuPont and getting some. Finally, with the Atkins, the adherence rate is very low. Okay, most diets, 40% people go off, except for Ornish. He found that his patients really stuck it out, and they enjoyed their diet. Side effects are bothersome, constipation, bad breath, etc. Long-term health effects are staggering. Many reports, people starting the Atkins a week or two later having a heart attack, because one of the triggers of a heart attack is a high-fat intake of food. So person goes into McDonald's and gobbles down a Big Mac, or goes to a Wendy's or whatever, they get a big fatty meal, they can actually cause a heart attack. Or if they have, same thing at their home, whatever. Big fatty meal can sometimes trigger a heart attack. So what about sugar? Well, a lot of people consume simple sugars like corn syrup, or if we have donuts, we have malasadas, all loaded with sugar and fat. And what happens when we take these foods in, when we take these very high simple sugars and fats? Well, we ingest these things, and what happens? You get a rapid rise in the blood sugar. Boom, spikes right up. Well, then what happens with that? With this rapid rise in sugar? That ends its way to the pancreas, which is an organ that releases insulin. Insulin is a hormone that will tend to lower the blood sugar. That's the function of insulin. Okay? It wants to decrease the levels of sugar in the blood. Is that so bad? Well, it is. It is very bad, because this is what happens. Insulin, when it rises in our bloodstream, activates this enzyme in the arteries called lipoprotein lipase. That will increase fat uptake from the bloodstream. So, when you have that malasada, let's say, or that donut, and it's all glazed, and you eat that and it has all that saturated fat and all that sugar, what you're doing is you take that sugar in, whammo, the insulin level goes up. Now you get all this fat going through the bloodstream. Lipoprotein lipase is activated. Oh, great. All that fat goes in to the fat cells. Okay? It just pushes it right in there, and that's what happens. You become an apple. And that's one of the big problems we have in the last 30 years. When the Nutrition Council came out during the Nixon administration, I think that's when they put the pyramid up. I'm pretty sure that was when they put the food pyramid, and they recommend people losing, trying to restrict their fat intake. What happened is everybody started making very sugary things, but they still had some fat in it. Okay? And actually, over the last 30 years, we actually increased we actually increased our calorie intake, somewhere around 400, 450 calories per man, about 300, 350 per woman. And so what happens is all that sugary substance plus the fat has given way to a global epidemic of obesity. The other thing that insulin does, it gets into the liver, and it activates this enzyme, HMG-CoA reductase, which is the enzyme that forms cholesterol. So if you take in a sugar bun, not only are you taking the fat, getting that fat, but you're also making the liver produce more cholesterol. Cholesterol from sugar? Yes, that's what happens by the action of insulin. And finally, insulin will increase arterial smooth muscle growth. That's one of the cells that's important in making the plaque. And when that happens, you form these big plaques and you get clogging of the arteries. You get congestion in the arteries and the sequelae of cardiovascular disease. So after many years, what happens is the body gets resistant to the insulin. You get this thing called insulin resistance, where your body needs more resistance, like a junkie, like a drug addict needs more and more of the drug to get that high, or an alcoholic. You need more and more insulin. That leads to what's called insulin resistance, and that further increases the triglycerides, lowers the good cholesterol, increases the blood pressure, it increases the sugar levels. Now a person becomes diabetic, and then you get these high heart disease rates. So it's very, very sinister. But doctor, I'm a meat eater. I've heard this. I'm probably going to get the same question when I give a talk at the Illichai next week. I'm a meat eater. I'm a carnivore. I got canines. I got to eat meat. You can't make me eat like a rabbit. So the big question is Arnold, the governor, is he more like an herbivore, or is he more like a carnivore? That's my dog Creo. So a question, are we more like the bunny, or are we more like the dog? Well, let's look at a couple things. Let's try to compare the herbivore to the carnivore. Well, if you look at the appendages of carnivores, they tend to have claws. Herbivores tend to have hands or hoofs. So if you look, I don't see any claws on me. I think I have a hand, so I think I'm more like the herbivore in that respect. Let's look at our teeth. The teeth of carnivores are very sharp. You look in his mouth, he's very sharp, all his teeth. Those of herbivores, mainly flat. Okay, you can say, all right, I got two here that are kind of pointy, but most of my teeth are very flat for grinding nuts and grains and berries and all that sort of stuff. So again, if you really have to look at the teeth aspect, we more resemble the bunny. What about the intestinal tract? Well, if you look at the intestinal tract of a carnivore, very short, very tiny intestinal tract. Those of the bunny, the herbivores, are very long. For instance, the small intestine of us is about 26 feet long. That's in order to digest the plant-type material. Carnivores don't need it. They have a short gut. And the reason why is meat is toxic to the colon. If you look at the cancer rates of colon cancer and prostate cancer, clearly related to the amount of saturated fat, meat, and dairy intake. Clearly. You look at the countries worldwide. The more meat and dairy the population consumes, the higher the rates of colon cancer. Colon cancer is number 3 cause of cancer deaths in the country because it's toxic. When meat breaks down, you get a lot of nitrous amines, and that is toxic to the cell linings and makes polyps. So you don't see much in the way of colon cancer in herbivores or vegans or vegetarians. So again, we are very much like the rabbit. Now, how do they drink? Carnivores will lap fluids. Herbivores will sip them. Similarly, that bespeaks us. Cooling, carnivores will pant. They kind of pant. You've seen the picture of the lion out there, the dog panting. Herbivores will sweat. So we sweat. So again, and vitamin C. Let's look at something metabolic. Vitamin C. The dog will make their own vitamin C. They don't need it to get it from the outside. Herbivores will obtain their vitamin C from the diet. And similarly, we need to obtain our vitamin C, or else we get scurvy, right? Like the British sailors got without the limes. So if we look at which of the above two develops plaques, atherothrombosis, it's impossible for a carnivore to develop atherothrombosis, no matter how much cholesterol or fat you provide it, unless you excise the thyroid gland before giving it the atherogenic diet. You can give a dog as much saturated fat and cholesterol as you want, you're not going to give it coronary artery disease. On the other hand, atherothrombosis readily develops in the herbivores, given a high-fat and cholesterol diet. And that was shown back in 1917 by Nishtikov with his experiments with rabbits when he fed them a meal that was laden with cholesterol and saturated fat. Clearly, those are the ones that develop. So, I hate to wake people up here, but most humans believe themselves to be carnivores. We eat flesh. Hey, doc, but fundamentally, our characteristics are more closely resembling that of the herbivore, and that is why we're dying. We are living like we're acting like a bunch of carnivores. And this is not said by me only, it's said by many cardiologists. William Roberts is is sort of a mentor in this regard. He says we are just acting like carnivores, and it's killing us. And he called it the circle of death. We end up killing the animals, and then years later they come back and they kill us. They kill us through cardiovascular disease and cancer, osteoporosis. They just plague us. It's sort of tit for tat, and what goes around comes around. And that can't be more evident in our diets, and that is the truth. Well, let's go on to stress, and we'll finish up. What you need, Mr. Terwilliger, is a bit of human caring, a gentle, reassuring touch, a warm smile that shows concern, all of which I'm afraid were not part of my medical training. So, stress, we have a lot of stress. We go see our doctor. He's not going to talk to us much about it. But clearly, it's implicated in cardiovascular disease. And I like to just kind of think of my five-finger approach to cardiovascular health, in terms of when I treat my patients, trying to think about what we need to do. One is a vegetarian diet. I'm convinced that the best diet to stay cardiovascular free of disease is a vegetarian diet. Vegan preferably, but vegetarian diet. Very low cholesterol levels if really put to the max. It's a good diet, drops the cholesterol, it's great for the animals, it's great for our society, it's great for everything. Clearly, it's the best diet. Exercise, we don't do enough of it. Half an hour a day, 45 minutes, the more the better, but something to nothing is better than nothing at all, right? Something is better than nothing at all. Exercise is very important. And doing these two things, we wouldn't have this problem with obesity, really. A lot of the obesity problems because we don't get our fordupas and we have too many fast food meals. So these are things that are hurting us. And so if we ascribe more to the first two fingers, we'd have a lot less problem with obesity. No smoking, there's no reason, it's criminal to me that smoking exists at this point. I mean, the FDA can withdraw Vioxx, but they can't withdraw cigarettes. I mean, it just makes no sense. It makes sense economically for somebody who's getting padded for it, but it makes no sense to spend money to pay some other company to kill yourself. There's a lot of ways to kill yourself. You don't have to pay somebody to do it. And psychosocial, we're going to talk about that, and treatment of other risk factors. So even if you do everything right and you have you still have high blood pressure or diabetes, well, clearly that needs treatment. A patient comes into my emergency room with a myocardial infarction. I don't tell them, listen, go have some alfalfa and see me next week. I mean, they're going to go to the cath lab, they're going to get stented, they're going to get a 2B3A inhibitor, they're going to get Teprin, Lovenox, whatever, they're going to get bypass, balloon pump, they're going to get whatever they need to get them out of the fire. It's like telling somebody who fell off the boat, well, listen, I'm going to have to teach you how to swim now instead of just throwing the lifesaver. So we got to be realistic too. But let's talk about psychosocial. You've stopped to smell the flowers? What the hell kind of excuse is that? That really says it all. Stress is a big problem. Stress leads to multiple things, as you can see here. It's not really given much credence in medicine. You know why? It's hard to measure. It's hard to measure stress. Well, what's your scale of stress? Mine's a 9 on a scale of 1 to 10. What's yours? Mine's a 3. I mean, how do you measure stress? It's kind of hard to measure. But remember that not everything that can't be counted doesn't count. Okay? That's an important thing. Not everything that can't be counted doesn't count. So let's look at stress. Let's look at acute stress. We are built to manage acute stress. Here's our stress level. So right here. So very high stress, very low stress. And this is time. This is an event happening. So here we are at level 1, homeostasis, the baseline state. We're driving along in our car, no problem. Nice and easy. Listen to music. Okay, no problem. All of a sudden, somebody comes out, crosses us, we swerve, okay, dodge a kid, go almost run over this one, tailgating, spinning. What's happening? This is what they call the flight or fight response. This is when the autonomic nervous system in our body, the sympathetic nervous system, says, I got to react very quickly now. I got to do something, okay? So what happens? Our heart rate increases, our blood pressure increases, our muscles get tense, our pupils dilate. What's that for? That's all for the fight. It's all to try to be ready and take care of the situation. This could happen if a dog is chasing us or a burglary is in process. Something happens acutely, boom, there's an immediate, what they call a flight or fight response. Get out of there or fight it down, either one. Once we pass the critical level, On the roadway, we get back into the lane, take a couple of breaths. What happens? This is what they call the rest and digest mode. This is from medical school. I'm sure Dr. Harris knows this. Rest and digest mode. This is the parasympathetic system. This is the yin or the yang of the autonomic nervous system. Okay, this is the yin part. This is the, all right, calm down, get the blood pressure go down, get the heart rate down, chill out, relax. You know, maybe a little sweat comes up. Sometimes it goes really, really egregious, and the person can even faint. Okay, sometimes you see that. Somebody sees a sight of blood, and all of a sudden, another half a minute later, they're fainting because their blood pressure dropped too much. Okay, so that's the yin of the yang of the acute stress. And then finally, we get back down to a baseline state of homeostasis, right? That's acute stress. We are built to react in such a form. I like to think my dog Creo is just like this. He's amazing. Amazing what you can learn from a dog. But he is like this to a T. He is so calm, so cool, but when he acts, it's like instantaneous, gets the business done, usually puts my other dog on his back, and then he's off, and he just, like nothing ever happened. That's the way it should be. Immediate response and immediate cool down. But we don't respond like that. We're going to look what happens at chronic stress. Chronic stress level, we're at homeostasis, we get up in the morning, now we're thinking, oh my God, I got to get to work, I'm running late, oh, I got to take the dog out, I got to make the lunch, this, that. This is my life in the morning. You know, get ready, in the car, what time is it, 7:20, oh my God, we're going to get to the H3 late, then there's a traffic jam, and it just keeps piling up. They're calling me, the stress test is ready, and where are you? And don't you remember you're going to do the echo on Mrs. So-and-so? She's here now, and you got 2 patients waiting, and all that. So what happens is chronic stress leads to chronic elevated stress hormones. These are the same hormones. This is a constant yang. It's a constant hyperactivity in the body's system. There's a lot of adrenaline, a lot of cortisol going, and what does that do? It results in chronic high blood pressure. We have a lot of blood pressure, undiagnosed and poorly treated. It leads to vasospasm, where the arteries can spasm. It leads to plaque rupture. It leads to increased tendency to form clots, and it leads to cardiovascular disease. And so chronic stress, chronically elevated stress, is bad. That's the connection. It's all connected through hormones, through these activation of the brain, the sympathetic system, the yang of the brain, the adrenaline, cortisol. These things increase cholesterol. They make more fibrinogen. The blood becomes more clottable. The platelets are more sticky. That's why we take aspirin if you have history of strokes or heart attacks. So chronically elevated stress hormones leads to this condition. It's a time bomb in the making. That's basically what it is. All the ingredients for the time bomb are all there, just waiting to explode. Now, don't believe me. Look at the InterHeart trial, which I just looked at before, to understand the association of psychological risk factors of acute MI, acute heart attack, in 11,000 patients. What they looked at stress at work and stress at home, and they measured it. They looked at financial stress and stressful life events. They looked at depression and something called locus of control, which is how much control the person has in their life. And what they found out, I'm not going to show the data, but basically, they found out that psychosocial stressors had a major impact on the occurrence of a first heart attack, clearly. Its importance was second only to cholesterol levels, the ApoB to ApoA1 level, as I showed you before. Smoking, clearly, was the next risk factor. Hypertension, high blood pressure, and diabetes. Next, out of the 9 or 10 risk factors, was psychosocial stress. So, very important, one of the fingers of the hand to try to reduce cardiovascular disease was psychosocial stress. And because with stress, with this very bad feelings chronically, it has definite biochemical importance in our bodies to cause plaque formation and plaque rupture. So locus of control was a key feature of the study. The loss of control the individual feels in their life, the hopelessness, or they just, they don't feel they have things together. The other thing which Ornish talked about was the role of isolation, and I'll just also finish because I think that's an important aspect too, and it kind of falls into this area as well with the InterHeart. I call it the "it's all about me" syndrome. It's been shown that the individuals that everything revolves around them tend to have a lot of stress because nothing goes their way. If they're being made to wait by somebody else, they have a problem. So it's good to try to think about the other person's viewpoint. It happened to me in Orlando. One time I was at dinner with my wife and kids, and my kids are young, in Disney World, and we're having a dinner at the end of the day, and this guy from the other table actually comes over. He puts his hands right on my table, and he's like, "Hey, can't you control your kids?" Just like that at my dinner table. This is Disney World. It's like 6 o'clock at night. We've been all over the place. Yeah, serious. And I think me and my wife just laughed about it. And we says, no, can you? We were like, I mean, how do you answer that, So this all about me syndrome has got to stop. Failing to accept that there are other viewpoints, and that's the same thing, and positions often leads to internal stress. So when we let things on the outside disturb us so much, it leads to anger, it leads to hostility. We may want to lash out, we may scream, we may get depressed about things, or we may have cynicism, like, oh, the world's against me, and, everything like this. And those feelings will lead to chronic stress, chronic hormone elevation, clearly, and that is one of the concomitants to form plaques. The other point, third point, is compassion begins at the dinner table. I think one of the things I really enjoy about becoming vegetarian is that, I can sit down comfortably to a plate now and know that an animal didn't have to suffer in order to feed me. Now you say, well, what is that? What are you talking about? Well, if you think about the lives that these animals have in captivity and the way they're put into these holding areas and really the chronic stress that they endure and the way they're killed, at the time of their death, they have so much stress in their blood, so much stress in their whole lives that when they're killed, there is such a release of cortisol and catecholamines that it's so much in their meat that when you sit down to have a slice of meat, you're actually eating the angst of the individual animal that animal had, that the life that animal had. You're taking all the suffering and all the stress hormones that have coursed through its veins at the time of death that you are now incorporating into your meal. To be really compassionate, it really should start at the dinner table. And then it can go out from that. The importance of one's choice between stimulus and response. And this is a key concept. You say, all right, Dr. Kristofich, I know you're talking big man, vegetarian, and exercise and all that. But, I got to have my meat, I got a barbecue, I got a tailgate party and everything else, What are you talking about? How can I do this? How can I change? You expect me to change my habit? Habit's the hardest thing to change, right? But habit offers the least salient truth or veracity for one's action. Just because you did something before doesn't mean that makes it right continuing to do it. So we get caught into this habit trap. We can't think outside the box. We get caught in certain ways of living. Listen, I lived on the East Coast all my life. 3 years ago, I moved to Hawaii. People couldn't believe I moved here. They were saying, oh, my God, man, you're moving? I said, yeah, I'm moving. Where are you going? Hawaii. Hawaii? Really? I says, yeah. I says, man, I remember the vascular surgeon, Dr. Meyer-Levy. He talks like Arnold Schwarzenegger. He goes, man, you got a lot of bleep. He couldn't believe that I was, just picking myself up, my family, everything just moving. Because the habit was to live there. Everybody lives on the East Coast. You stay on the East Coast. Live and die in L.A. type of thing. Changing one's habit sometimes is the hardest thing. But what you can do is you can think of the choice you have when you have a stimulus and you're going to have a response. Very important. This has been said by a lot of other thinkers. We have these stimuli. I'm hungry. Or something just happened. The kid just yelled or dropped the glass, or my boss told me, call me into the room or whatever. And, you have this importance of, you got a stimulus, you're going to formulate a response to that stimulus. You have choice. The choice to either do one thing or the other. Sometimes you don't have a choice. You have to act with a reflex. But many times we have the ability to choose. So, again, and think about vegetarianism and changing one's lifestyle, whether it be exercise or stop smoking. You can have a choice. You pick up the cigarette and say, listen, somebody's telling me to smoke. The response is to smoke, or the response may be, I'm not going to smoke. I know this thing is killing me. I know I'm paying people to kill me with it. I'm not going to, get into this thing. I don't want to be sick, okay? Or the same thing with the eating habits or exercise habits. It's that moment of time where it's very crucial to really evaluate and think, how am I going to respond to this? And it's hard. Sometimes the hardest things, the best things, sometimes are the hardest things. It's not easy to stay healthy. It takes a lot. We should demand it from ourselves. We should say to ourselves, I don't expect to go through life and just kind of let everything just go and, get heavy and exercise, smoking, and lack of sleep and poor interpersonal relationships and think you're going to get away with it. We're not. We're not going to get away with it because it's just going to come back with one of these events, whether it be a heart attack or stroke or whatever, sudden death. Okay, so importance of really trying to think of the choice we have between a stimulus, what's out there, what's coming in, and how we're going to respond. Again, last, I'll just leave this and I'll take some questions. Albert Schweitzer, Dr. Schweitzer, any religion which is not based on a respect for life is not a true religion. Until he extends his circle of compassion to all living things, man will not himself find peace. We must never permit the voice of humanity within us to be silenced. It is man's sympathy with all creatures that first makes him truly a man. Thank you. So. Next question.
Yes, can you address the high fructose corn syrup?
Right. High fructose corn syrup. Again, that's a major ingredient in most of the cereals out there, soft drinks, is high fructose corn syrup. Very sugary, enters the bloodstream very rapidly, causes an immediate rise in insulin. And with that rise in insulin, it can wear out the pancreas. It can lead to mechanisms by which fat is absorbed. So the killer cocktails in society are things like the malasada, the donut, the coffee with cream and sugar. I mean, half and half, sugar and a cup of coffee. You're increasing your sugar levels, the cream starts going into the fat cells. The best sugars are the complex sugars. Instead of white bread or white rice, you can still have it, but little of it, but mostly dark bread, the long grain rice, the wheat breads, all the natural type complex carbohydrates are clearly the best. Back there. Yeah, inflammation and cardiovascular disease, very important topic. I didn't cover it, but basically inflammation has to do with the blood's capability of forming plaques. If I take my hand and I smash it against this podium, what's going to happen? I'll get swelling, it'll get red, it's going to hurt when I touch it, I may have loss of function, and pain. The bloodstream is a tissue as well. The bloodstream itself is a tissue. Now, you can't take your blood and smash it against the podium. Inflammation of the blood does occur. How does it occur? Well, it occurs through all those risk factors we talked about. If a person's a smoker, how heavy are they? That people who have a lot of fat in their abdomen, the so-called apples as compared to the pears. The fat tissue itself, the adipose tissue, sends out inflammatory signals to the liver, which then further amplifies that and alerts the bloodstream that there's something bad going on. If we don't exercise, if we have high blood pressure, if we have diabetes, if we have too much sugar in our diet, these things inflame the blood, and they make it more likely that that blood is going to make plaques, and more likely a person is going to have a heart attack. So a person who comes in, their LDL cholesterol is 65 or 70, let's say, very low, and their inflammatory level, we can measure that with a blood test, an HSCRP, is 0.05. These people are golden. I mean, it's very rare that they're going to form plaques or have a heart attack. Whereas they come in, their LDL is 160, and their HSCRP is 4.2. Don't buy any long playing records. Okay, I think that's about it. Okay.
As usual, there's our refreshments from Down to Earth prepared by Ariokata Berkeley in the back. If you have the energy, we need stacks of 10 chairs. That would help us finish off the meeting. Thank you very much for coming. Aloha, everybody.
This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. 3 monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. For an application, call 944-8344. That's 944-8344. Or visit our website at www.vsh.org. vsh.org.